Good afternoon. My name is Dr. Jonathan Belinski. I am a senior health advisor here at Oregon Health Authority, and I also get to be the director of the Division of Public Psychiatry at Oregon Health and Sciences University. You might have guessed from that I'm a psychiatrist, and that is true. Welcome to our Facebook Live session this afternoon. We thought we'd start by giving you a quick update on where we are as a state with COVID-19. As of today, there have been a total of 33,509 cases, confirmed cases of COVID-19 in the state of Oregon, with 220 cases, new cases in the last day. Unfortunately, this means 559 people have died in our state from COVID-19, 4 of those in the last day. Long story short, this is a really challenging time for many Oregonians for a variety of reasons. Many Oregonians are continuing to deal with the devastating effects of wildfires, in addition to the ongoing COVID-19 public health crisis, and of course, all of the social and economic impacts that result from that. We want you to know that it's okay, it's even natural for you to not feel okay right now. In fact, if you need support, please know that help is available for you. For example, one resource is the Safe and Strong helpline at 800-923-4357. That's 800-923-HELP. The line offers free 24 hours a day, 7 days a week, emotional support and resource referral for anyone who needs it, not only those experiencing a mental health crisis. Should you call, you'll be routed to a counselor who can provide emotional support, mental health triage, drug and alcohol counseling, crisis counseling, or just simply human connection. You can also find behavioral health resources on OHA's Safe and Strong page at safestrongoregon.org. That's safestrongoregon, all one word, .org. There, you can find mental and emotional support information and resources, as well as guidance for how to have conversations with loved ones who may be struggling. Another option is SAMHSA's Disaster Distress Helpline. SAMHSA stands for the Substance Abuse and Mental Health Services Administration, and their distress helpline provides 24/7, 365-day-a-year crisis counseling and support to people experiencing emotional distress related to natural or human-caused disasters. You can call SAMHSA's Disaster Distress Helpline at 1-800-985-5990 or text "Talk with Us" to 66746 to speak to a trained crisis counselor. I also wanted to take a moment to remind you of some tips for supporting your own mental health. Some of my favorite work has been done by a pair of psychologists named Julie Hitch and Andrew Fleming, and they recommend a threefold approach for staying sane in a world that doesn't seem very sane. The first of those steps is to set a reachable goal every day. It's really important for us as human beings to be able to have a sense of mastery over our environment. So setting a reachable goal every day helps reinforce that. And that might be something as simple as folding the laundry or vacuuming the living room. Whatever it is that you know you can get done that day, set that goal and finish that goal. The second thing is to find an element of pleasure every day. It might be enjoying your child's laughter. It might be something endearing that your pet did. It might be something great that happened to you at work. But whatever it is, take a moment and deliberately enjoy something every day. The third thing is to make sure that every day you connect with another human being. It might be from calling one of those hotlines that we talked about. It might be a conversation with a loved one. It might be something by video conferencing or even text. But make sure that you connect with another human being every day. Those three things will go a long ways towards helping you feel better. But physical health is also incredibly important to mental health. The first thing that I like to talk about when somebody comes to see me is sleep hygiene. It turns out that getting 8.5 hours of sleep a night is really, really important. And there's a lot of things you can do to help improve your chances at getting a good night's sleep. One of my favorite rules is your bed is only for 2 things, and you know what those are. But if you do an internet search for the term sleep hygiene, you'll find a whole list of other things you can do to help improve the quality of your sleep. Next up is physical exercise. Not only will physical exercise help improve your sleep, but physical exercise is the most important thing you can do for brain health. So make sure that you are moving your body every day. Remember, for us grown-ups, that's about an hour of exercise for most every day of the week. And finally, what you eat is really important. In short, the more plant-based and the more whole foods-based your diet is, the more likely you are to have a healthy brain. So choose your food wisely. And finally, some tips from my own experience. Number one, feel free to take a break from the news. The wonderful thing about our 24-hour news cycle is that it's always there. So you only have to check in on it once a day, or maybe once every other day, to find out what's going on in the world. Do what you can to focus on the present moment and what's going on around you right now. It might be as simple as something like, I'm safe in this moment, my feet are on the ground, and I can smell fresh air. But reorienting yourself towards the present will help reduce the amount of anxiety you feel worrying about the future. And finally, when you do find yourself overwhelmed with anxiety, see if you can channel that anxiety into helping somebody else. There's something powerful about taking our energy and using it to help other people that helps calm our own anxiety. And with that, I'll turn it over to my colleague, Dr. Ruth.
Thank you, John. Good afternoon, everybody. My name is Dr. Ruth Zúñiga, and first I want to say thank you to OHA for the invitation to speak today, and thank you to you, the audience, for joining us today. I'm go by Ruth and pronounce she, her, ella, and I'm a Latina first-generation immigrant, and I'm a mother, and also I'm a wife, and I'm a professor and also licensed psychology at Pacific University in Forest Grove. Most of my work has been focused on Latino psychology and working with the Latino communities, and also working with communities of color. And therefore today, when I'm going to be talking about some tips, I'm going to be thinking about people of color and giving some tips and some ideas about how we, people of color, can engage in self-care and taking care of our emotional health during this difficult time. As we know, COVID has and will continually discriminately affecting people of color in many multiple ways. For us, the loss of sense of connection with others, the loss of job, maybe the loss of income. There is constantly a sense of uncertainty, and many of us don't know what's going to happen tomorrow. That by itself, in addition to that, there is also those many sociopolitical and difficulties that we as community of colors are experiencing right now, and that adds to the stressors and experiences that we are having right now. In other words, we can say that COVID-19 has highlighted the systemic inequities in nearly every sector for Latinx and for Latinos communities. And because the pandemic is affecting, is creating a lot of stressors in our lives, it's affecting our mental health in ways that we have not seen before. And therefore, we have to be thinking about what can we do to strengthen our emotional health, the same way that we think about strengthening our physical health and thinking about our immune physical health right now. Many of us are trying to protect to avoid contagion. We can be thinking about how can we strengthen our psychological, emotional well-being. And because there is a strong connection between physical health and emotional health, by us taking care of our emotional health, we are going to be protecting our body, ourselves, our loved ones, and our communities. So the question that you may ponder is, so what do we do? What can we do to protect our mental health during these difficult times? The first thing will be go to the basics. As John mentioned it is so important to go to the things that are very basic, such as eating healthy, drinking plenty of water, sleeping, finding time for playing, and also praying. But also for communities that are not part of the dominant culture, for us, creating routines in forms of rituals are very important. A ritual is similar to a routine, but something that may help us also feel connected with maybe higher power, maybe with the community, maybe with our ancestors. Sometimes can be having potentially a meal together with the family once a day or once a week, or calling a family member that maybe is not with us once a week. The other thing that is important for us to remember is that we are a strong community. We have a lot of strengths, and we have overcome many challenges in the past. Think about all the times that you have overcome challenges in the past. Many of us are immigrants, and that when we came to this country, that was potentially very difficult. And many of us have struggles in the past with other situations, so we can think about it. What helped me in the past, and how can I apply that? How can I apply that, what helped me today? There is one saying in Spanish that says, vivir un día a la vez. So that means living moment by moment, one day at a time. So that means that trying to connect with what we have right now, and potentially also connect with our blessings. What are you thankful for today? For many of us, is food in our pantry, our loved one for our children. Maybe for some of us, we are fortunate enough to have a job. So think about the things that you are thankful for and write it down, or just think about it, share it with other people, but just counting the blessings is a really good buffer for emotional health. Doing activities for self-care means that we are meaning things like dealing with stress will help you and will help us, but will also help our family members. It will help our community, and especially for many of us as caregivers of younger children, it is important that we engage in self-care as a way to model and be an example for the community, for the children and for our young children. Connect with our higher power, with your higher power. That is super important. Maybe connect with your religion or your spiritual beliefs. And also try to find ways to connect with others via the options that we have right now, like social media. For example, for the Latinx community, there are many social media options where you can learn about mental health. One of them is charlas comunitarias, like that, charlas comunitarias. So you can search that in Facebook. Another thing that is important is to be okay what we are experiencing right now. Understand that our feelings, your emotions, no matter what are they right now, they're valid. So sometimes we may want to cry, and that's okay. And there are other times that we may be confused, that's okay. It is important to be kind to ourselves and to understand that we have never gone through a pandemic before. This is the first one, and we don't necessarily have a manual to deal with it. So therefore, our experiences and sometimes those emotions that may not feel comfortable are appropriate. The last thing that I want to say is the importance of talking with mental health professionals, mental health providers. The same way that we go and talk and seek primary care physicians for primary care to make sure that we understand how we're doing or to treat any medical condition, it is important that we also seek mental health support and talk with professionals about feelings and experiences that we may having. There is a lot of times, a lot of stigma within our communities about psychologists and mental health professionals, and should I share information with others about my life or my experience? It is okay. It is very normal to seek out help, and we will love to hear from you at times. So I think that's what I want to say, and at this moment we will take some questions, and I want to make sure that we can get most of the questions that we are going to be focused on right now are regarding mental health and COVID-19. We will not be able to cover other topics.
All right. It looks like our first question comes to us from Jenna. And by the way, feel free to enter your questions into the box, and we'll do our best to get to those as well. The first question today comes from Jenna, who asks, how do I deal with the stress of my child's online learning? Jenna, Yeah, wow, that is not an easy thing. The whole world has changed for kids, and in some ways in many ways it's a wonderful time to be a child. You get to spend a lot more time with your family, and in some ways it's a really difficult time to be a child because you don't have school, you don't get to hang out with your friends like you used to, and some children, unfortunately, are stuck at home with parents they don't necessarily get along very well with. I think something that you can do that's really important is to make sure that you're taking care of your own health. If you're able to get a full night's rest, and if you're able to make sure that you're getting some exercise, and even better if that exercise is playing with your children, I suppose. If you're able to do those things, you will be able to be much more resilient and much more patient with your own child. The next thing is to remember that schedules are really good things for kids. So even if whatever school they're attending doesn't necessarily have the same regular schedule that it used to have before, whatever you can do in your household to help maintain a schedule, the same time getting up every day, the same time breakfast, the same time lunch, the same time classes, the same bedtime every day, those kinds of things will be very, very helpful. And finally, it's really great to demonstrate empathy with your child, to acknowledge with them and to talk with them about how hard it is, and to give them a space to be able to talk about that. Ruth, any other comments on that one?
I think the biggest thing is, as you mentioned, John, modeling. By taking care of yourself, Jenna, and all the parents out there and caregivers, by taking care of ourselves, hopefully the children also learn how to take care of themselves. And validating the experiences of the kids. This is a stressful time for children as well, so validating their experiences, validating their emotions, and also by us taking care of ourselves, we tend to have more energy to give to our children, so that is a very important way to go about it. Self-care.
All right, thank you. It looks like our next question comes from Claire. I'm very lonely. I'm used to spending time with family and friends. How do I deal? Well, I'll tell you, I think it calls for a little creativity for each person and each situation. We don't get to spend time in person in the way that we used to, but we can, hopefully, at least while the weather is still good, come up with some creative ways. So it's very much okay to stop by and visit your family outdoors. I would recommend, unless there's somebody you live with, that you stay 6 feet away from them while you're outdoors, but by all means, do spend time. As weather gets worse, for example, my extended family, we have a family video conference. We have a Zoom conversation every night at the same time, and whoever's available connects into the Zoom link at 8 o'clock every evening, and so we have a place where we can all get together and talk about things and problem solve and love each other.
So the next question comes from Maria, and Maria said, I'm a young adult and feel depressed. What can I do? So it is important to understand what, are you feeling depressed, or are you feeling like your mood is low, that you don't feel very well within yourself. So if you're feeling like your mood is low, if you're feeling like the sense of depression that you're having right now is affecting your work, it's affecting your roles as an individual in the community, it's affecting areas in your life, in your daily living, it is important that to the best of your abilities to speak with somebody, a professional, about it. To talk with somebody about it. Right now we have a mental health available services for people affected by COVID. Anybody that is affected by COVID, that pretty much all of us, can have and access free mental health services in this Pacific Psychology Clinic, and I'm going to give that phone number right now. Is 503-352-7333, 503-352-7333. Our services are free, and also we provide services in Spanish and English. It is important to know that managing the stress, doing physical activity, as John was saying, eating a healthy diet, taking care of our sleeping and sleeping enough, taking moments for rest resting is so important for healing the body, but also to heal the emotions. So by taking care of managing your stress using these things, symptoms of depression may improve, but I think most important is we need to know, or it will be important for you to know, is this just a little bit of sadness that you are experiencing, or is this more a truly clinical depression that needs to be treated by a professional? And John, I don't know if you want to add anything else about that.
I think that was a great answer. I thought I might move to the next question. Astrid asks, or says, I totally appreciate that there's a COVID crisis right now, but what's being done to support the mental health of university students? Astrid, great question, and the best answer I have for you is that it really varies from institution to institution. So most universities have counseling available to students in some form or other. Most of that counseling is now by telephone or video conferencing. There's not necessarily a center that you can drop in. But most institutions are making a dedicated effort to restructure their programs and to reach out to students at university to make sure that they're okay, because the world is very different for them as well. Even if they've gone back to school in person in a place where they live, they might be limited to just their hallway in the dorm, and they're not able to socialize with other students in the ways that they're used to. So no doubt about it, this is a different world for them, and it's hard. And most universities are doing their best to adapt to that and to provide services.
So Dina asked us what resources are available to assist families who are dealing with hospitalized family members they cannot visit and are quarantined at home. So in regards to resources, I will recommend to actually call the Safe and Strong line to figure out what is available right now in regards to resources for people who are in quarantine, or for people that are actually experiencing the struggles of not being able to have contact information with families who are in the hospital. On the other hand, we recommend that the mental health, as a mental health providers, that's what we want to focus. We want to recommend, or I will recommend, to watch out the mental health not only of the person that is experiencing COVID, but the caregivers of those people, or the loved ones that care, even if not actually care, but just that love that individual, to be able to provide that.
That number again, oh, got my mask tagged, caught up here. That number again for the Safe and Strong helpline is 1-800-923-4357, 800-923-4357. The next question comes to us from Jermaine, who wisely asks, with winter approaching, how are people supposed to cope with COVID and mental health, particularly if they can't meet outdoors? Jermaine, thank you for this question, and there's a whole lot of folks statewide and countrywide worried about the impact of approaching winter and how much it's going to change our activities. Here in Oregon, people sort of disappear for the winter because we all move indoors, and of course, moving indoors means that we don't get to see people nearly as often as we do when we can meet with them outdoors during COVID times. I think it's going to call for a lot of creativity and flexibility on our part. The first thing to remember is that in addition to socialization and meeting with other people, there's a whole lot of other things that we can do to maintain our own mental health. We can keep eating wisely. We can keep maintaining our sleep. We can keep up with physical exercise. We can keep up with deliberate enjoyment and reminding ourselves to focus on the present moment. And we can keep taking breaks from media. And then, as far as the social stuff goes, I think we can do creative things. We can use Zoom to watch movies with our friends, and so we can play games online. There's a variety of things that we can do to still maintain social connection and still be able to do things that will help improve our own mental health. Ruth, I wonder what you'd like to add to this.
I think this is also opportunities for us to, maybe this is the winter, for opportunities for us to develop new hobbies, to develop new routines, to develop new rituals, and to connect in other ways with people. Many of us, a lot of times, are running, and not able to have those connections anymore. So now, the way that we can connect, as John was saying, with creativity, maybe via Zoom, maybe the connection is now through letters, going to the old system of letters. Maybe the way that we can connect with others is by doing something for others. That's another important buffer for mental health. And the way that we can do something for others, for example, children can actually do cards for, we can, as a family, do cards for, with the children to give to the supermarket workers, to thank them for their work every day. So that's another way to connect. So I will add doing things for others in new, innovative ways, and maybe going back to things that we used to do, such as writing letters, sending a nice email.
And to that, I would add one last thing, which is a very old aphorism taught to me by my good friend, Ranger Bob. There is no such thing as bad weather, only poor preparation. So we can still be outdoors, even in winter. The next question comes from Barbara, who asks, what about the mental health of seniors in long-term care facilities? Another great question. You know, when we first started to have to engage in physical distancing and locking down to try to prevent the spread of this virus, one of the first places that we had to do really hard lockdowns was assisted living facilities and other residential places where older adults live. Some of those restrictions have been loosened a bit. Some visitors are now allowed, especially outdoors. But I would encourage you, if you have a loved one who's living in some sort of residential facility, work with that facility to find out what ways they've been able to come up with for you to be able to connect with your family member. I think that's really important. Most have video conferencing options. There's always phone calls, but most have also come up with ways for you to be able to visit outdoors. Even if it's raining, they may have an outdoor covered area.
And some senior center facilities also do windows visits, where people can still have that social distancing, and maybe it's not necessarily having an outdoor space, but having windows visit may be possible. So Lori says, or asks, do you have tips to cope with worrying about loved ones in denial of risk? It takes breaks, but they don't take time. They don't take my concerns as seriously as I think they should. Your experience, Lori, it is the experience of many of us, and especially many people don't understand the seriousness of COVID and the seriousness of contagious of the illness. And so I think understanding that your concern is a concern that many people have. And then the question that you have and that you're asking us is, what can you do with those loved ones that are not taking this seriously? So there are different things that potential could help, but it is avoiding conflict or avoiding just directing and telling them what to do. We as human beings don't like to be told. A lot of times we really like to give consejos, tips to people, but if the person that you love or those people that are loved ones are not ready to listen, they may not hear you. So maybe having conversations with them about your worries, about your experiences, and what is it that worries you about. So talk about more about yourself and not necessarily about what you think the other person should do. A lot of patience, definitely, especially as this can be frustrated when we may be concerned about others and they not take the illness seriously. John, what else do you want to add to that?
I would say if it's somebody that you have an existing relationship with and you feel comfortable engaging them in conversation, to ask them about their position and why they're making the decisions they do. Oftentimes it's something as simple as, it's really annoying to wear a mask and it's itchy and I get acne and I don't like it. And you can say, yeah, I don't like it either. Wearing a mask really annoys me. And here's why I choose to wear one, or here's why I think it's important. So really trying to understand the emotions behind somebody's decision will often get you a long ways. Mm-hmm. Kira asks, what about people who make too much for OHP and too much to be on a sliding scale for low income, but can't afford health insurance to see a therapist. Kira, I think the first step I'm going to recommend is to call that Safe and Strong helpline at 800-923-4357. The person who answers the phone can help you understand what your options are. If they're having difficulty understanding things at your county level, you might also use your favorite internet search engine to look up the number for the mental health crisis line in your county. The folks who answer those lines are very wise about resources available in your county and can help you figure out what the options are that are available to you. It's a tough spot to be in, but here in Oregon there are still options available to you.
And we have the last question, which comes from Sarah. Sarah says, how do I cope with the stress of having a COVID-19? And I just wonder if the question is about the stress of being at risk of having COVID-19 or the stress of actually experiencing and being a survivor of COVID-19. It is very important. What I will recommend is there are currently a lot of services offering in the community for people that have experienced or are experiencing COVID-19. Mental health resources, John mentioned several of them, but we have mental health resources in your counties, in your communities, specifically to help deal with the challenges, the emotional challenges. Sometimes it is the fear of the future, the fear of the consequences of the illness, or the external consequences that the disease may have caused, such as, loss of jobs or loss of income. So talking with a professional, also talking about your fears or your emotions with somebody else. Don't isolate yourself, but instead talk with others about your concerns. Anything else, John?
I think, unfortunately, we are fresh out of time, Ruth, so we'll have to leave it there, but thank you so much for joining us today. Stay safe, stay healthy.